Secondary would be like screening. So you're preventing the, um, be preventing like the disease from, getting worse, taking its course, propagating.
Okay. Okay. So what kinds of things do we screen for?
COVID.
COVID. Okay. COVID testing. Good. Okay.
Routine mammograms. So my current position, I'm a wellness coordinator for an insurance broker's office. So we do a lot of the preventive care and screening. So one of our clients that's primarily females, we have a mobile mammography unit come once to twice a year to make it easier for their population to get their yearly mammograms. And we have caught cancer that patients never even knew they had in the beginning stages. So
Oh, that's a great example. That's
very
really
rewarding.
Yeah. So wellness fair, so you could do health fairs. What other diseases can you prevent by screening, or at least identify early on?
Hypertension.
Cancer.
Hypertension. Yep. What else?
Diabetes.
Diabetes. Okay. So yeah, hypertension, cancer screenings, diabetes, so different types of screenings. School nurses, which is a role of a community nurse. School nurses screen for what kinds of things? Do you know what they screen for in the schools?
Vision and hearing.
Yep, absolutely. Vision and hearing for kids, and
Scoliosis.
scoliosis. Yep. Okay. They also, well, we'll talk about that more in the second lecture, some of the role of the school nurse, but they're also screening kids for any signs of neglect or abuse, those types of things. Okay, and then the third type of prevention is the tertiary. Okay, so who is a recipient of tertiary prevention?
Is that like the skilled nursing facilities?
Okay. All right. So, what kind of preventive measures would you do in a skilled facility?
Medication management.
Okay, medication management. Okay, very good.
Comfort care.
Say that again.
Comfort care.
Comfort care. Okay, so that could be if someone's like at the end stage of life type thing. Okay, so the idea of the tertiary is somebody who already has the illness. They already have chronic disease, and so we're educating them on managing their disease. So while we do some tertiary prevention in skilled facilities, I'm thinking more that it's taking place in a patient's home or even in the hospital, because they're already in the hospital. So one of the things, so the idea is to educate that patient, right? How to maximize the quality of their life within the constraints of their disease. Does that make sense? So if somebody already has heart disease, what kinds of things would we be teaching them to improve their quality?
Diet and exercise.
Diet and exercise. Medication management. Phoebe, you had mentioned that, right? Or you said comfort care.
I said medication
Princess did, yeah. So medication management. So do you see what the difference is between those three levels of prevention, right? And the idea is no matter which level we're at, what our patient is and what we're doing to help them or teach them, we want them to have to be on the end of the continuum of wellness. So even if you have a chronic disease, you can be at the highest level of functioning on that wellness illness continuum. Right? So education again is the diet, the exercise, medication, signs and symptoms to report to the physician. So those kinds of things are all part of the tertiary prevention, but maximizing their level of function on the wellness continuum. Even if somebody does have a chronic disease, they can live as healthy a life as possible if they understand the measures they need to take to ensure that. So in community-based nursing, we have all these different levels of prevention that we talk about, and the upstream thinking is really what this is about. Primary prevention is mostly upstream, because we want to get to the person and help them to prevent getting a chronic disease to begin with by living a healthy lifestyle. In the community-based nurse, there's a lot of, and again, there is a lot of overlap in when I talk about some of these things, because we'll bring it up again in our second lecture, but there are nurses in the community that have nurse-run centers. And what they do is they actually go out into the community and they go into people's homes and they look for environmental conditions that could cause somebody to have illness, such as lead paint. It could be that they have rusted pipes. You know, there's a lot of environmental things that we can do. So community-based nurses that work out of various health centers in communities can actually go into homes, working with those communities and identifying areas that are of concern so that they can develop a plan to address that area of concern. So let me look at my objectives for this class. So we kind of have touched on the levels of prevention. Let's talk about the healthcare disparities and social determinants of health. And what can you guys give me any examples? Do you understand what the social determinants of health are?
Yes, like they're saying right now with the COVID, they believe that it's going mostly to a select group.
Okay, and why do you think that is? And what does that mean then?
Financial influence. I mean, it's not going to where it's needed. It's going where the most influential people are.
What is going, not the disease?
Oh, the vaccine.
The vaccine, okay. It seems that there is, well, it doesn't seem, there are definitely disparities, and those are what are known as healthcare disparities. So that not everybody across the board has the same access to healthcare. And there's a lot of reasons for that. Unfortunately, in this country, and probably in other countries too, people of color are considered vulnerable populations because the access to care is not as available. There is where a person lives. Okay, so they have healthcare disparities because of where they live. Does somebody living in a rural community, is that a healthcare disparity, do you think?
Yes.
Yes. Why do you say that, Riley?
I'm Princess.
I know, I thought, you know, I know you are, and I can see your pretty face, but I'm just saying that because what happens when I talk to you guys, the little boxes light up. And so then I think that that person spoke, but anyway. So yeah, so again, it's access to care. If you don't have access to care, you live in a community where there isn't a lot of healthcare facilities, or the nearest health hospital is 30 miles away, then that's a disparity. Okay. Uh, So what can we do about healthcare disparities? Any thoughts? One of the things you guys are going to do today, if I can figure out how to do it, and I might need you guys to help me do it, is to put you into breakout rooms. And you're going to look at the different indicators. I have specific indicators for the healthy people. 2000 and in your groups you're going to work, and you'll talk about how these disparities, it's listed as a classroom activity. So we'll go through that, and that may help to explain this a little. Okay, I'm just looking at that. Okay. So one of the roles for the community nurse is to look at those disparities and try and close some of those gaps in healthcare disparities. So do you get the difference between a public health nurse and a community-based nurse? Okay, so the public health nurse is a nurse with an advanced degree, and it could be a bachelor's degree. I mean, but most public health nurses have either a master's or a doctorate, and they're looking at collecting the data, they're analyzing it, they're meeting with people that are involved and important when it comes to making change, such as the local community politician, but they work on changing policy. So that's what the public health nurse, they're more finding the evidence, they're doing the research, collecting the data, and developing policies to improve the health of that community. Whereas the community and the public health nurse is much more involved in primary preventive care. Okay. So if somebody is in a community and they're in an area where they don't have access to care, or there's other disparities, what is it then that the public health nurse would get involved in, right? They would assess, determine there's this problem, and then they would develop policy to increase or improve the access to care in that community. An example would be even when you think about telemedicine. So there was a time in rural communities in particular, if somebody doesn't live close to a hospital and they have a major problem that happens, or even a smaller problem, they can do telehealth, telemedicine now, and then they have better access to care. So that's sort of closing that gap about access to care by using telemedicine and telehealth. I had a video that I used to have up there, but it was over an hour long, and I'm pretty sure that was the video that showed in the Delta area of Mississippi, the rate of diabetes was extremely high in that area. So once they instituted, and a public health nurse came in and assessed that, determined this, we need to address this issue of the diabetes that's out of control in this area. So a lot of education, and then they set up this telemedicine where they are monitoring their sugars, sending the results to wherever it is where the person is in charge, and they are working on reducing the incidence of diabetes through this telehealth monitoring. Okay, so that's an example of what a public health nurse can do in terms of primary prevention. Whereas, so the community nurse, the community-based nurse, is really working with patients that already have the disease, or the screenings, like I said, to address it early on. So primary is preventing it from ever happening in the first place, you know, and then secondary, tertiary is more the community-based nurse, because the people they're seeing in the community already have illness and disease, so they're addressing it with them and teaching them how to manage that disease. Does that make sense, you guys? Does that help? Let me just see. So the okay. Let's talk about the so we're talking in general now about community and the health of the community, right? And so in order to determine the health of the community, including the people in that community, we have different ways of assessing the community. What are some of the ways that we do community assessments? So there's
Windshield.
quite a few different methods. So say that again, Christian.
Windshield survey.
Windshield survey, yeah. And we're going to talk at length about the windshield survey, and that is going to be something that you all will need to do for this class. So we'll talk about that in a few minutes. So what exactly is a windshield survey?
It's I think you said it was like driving through different communities, looking at the housing structure. Is it row homes? Is it big homes? Is it apartments? Looking at the different demographics. What do the people look like? Are the people different at night than they are during the day? You know, are there any parks? Anywhere to exercise? Is it just concrete everywhere? And
yeah. So why are we why do we do community assessments? What's the whole point of a community assessment?
To recognize the health needs of people in a certain area to address them.
Exactly. So the whole point of a community assessment is that you want to look for any areas that may be of concern in terms of the health of that community, which then translates into the health of the people. And then addressing that concern and seeing what you can do to fix it. If not fix it altogether, at least make it better. So one of the ways is the windshield survey. So you spoke of a couple things under the 3 headings in windshield survey. We're looking at the people, the places, and the social systems. So those 3, those are the overarching areas that we look at. So who are the people that live in that community? Are they, you know, do they look like they have money, or do they look like there's a lot of poverty? Are there a lot of animals? So we talk about the ethnicity. Is the community racially cohesive or racially divided? How are the people dressed? So that, do they look different in the day or at night? We look at different, so we look at, is there any evidence of different classes of people? And then also any evidence of any kind of communicable diseases, drug abuse, alcoholism. So those are the people. The places, you know, where is this? So where is this community located? So oftentimes, so you want to look at, are there factories around this community? Are there highways surrounding this community? that would be important because we're looking at the environment of that community, right? So if you live near where there's a lot of active factories, there may be a lot of air pollution. Same as if you live near highways, or are the boundaries water boundaries, you know, so you want to look at the boundaries. There's also political boundaries. You know, is it a Democratic area, a Republican area? What kind of political boundaries are they? Because that may influence what type of services are there. Looking at major health institutions, local healthcare providers, so doctors' offices, clinics, all of those. Are there any, so these are still listed under places. The housing itself, what's the quality of the housing? When were these houses built? If houses were built before like the 60s, there's a good chance that there's lead paint in the houses. And lead paint can cause brain damage and a lot of physical and mental disabilities. And toddlers like to chew on the paint chips of lead paint. So we look at the quality of the housing. Are they run down? Are they brand new? Those type of things. And then, like I said, the industry in the area. So we look at that because that's all environmental, can contribute to environmental pollution and affect our health adversely because of it. And then in terms of social systems, you know, you're looking at transportation, schools, churches, food. You guys, I know you've heard about food deserts. So does this community have grocery stores? Or do people have to travel great distances to get their healthy food? So, you know, if there are no large grocery stores, then typically they are food deserts and they don't have a lot of healthy food choices. Police and fire, and as I said, public transportation. Many people don't have cars. So you looking in the neighborhood and you might see some work vans, but not cars, then is there public transportation available for people to get there? So we do all these types, we do the windshield survey as one type of assessment. It's the most common in just a general overall assessment of that community. And typically in areas where there is high pollution, factories or near highways, oftentimes those are industrial parks. Oftentimes those are areas where poor people live. So there's already, you know, a couple strikes against somebody who's poor. They not only have housing may not be that housing that is substandard, but they also are an area where there's high air pollution, environmental pollution. And so another example of a healthcare disparity just based on where somebody lives. The next type of, another type of community assessment would be, do you know what the informant interview is? All right, so think about that one. Informant interview is when you want to talk to somebody who knows the community. It could be a politician, you know, like the mayor, or it could be, you know, let's say the community you're looking at, it might be something to do with the school. So it would be the school board, you know, so whoever the person is that's informed and has the knowledge, that's your person you talk to during an informant interview. Okay, so that's one way to get right to the crux of the information you want by asking them. So those are interviews that you set up. So you call and make an appointment. It could be the representatives for that area, whether it's local or, you know, state or local congressional leaders or Senate. Those types of people are all informant and people that you could talk to. Another one would be participant observation. And again, this could be, there's a community forum or a meeting, and you go and you listen. You just observe and listen and gather information that way. Other ways to collect data, you could do surveys or informal interviews, okay? So these are all different types of community assessments that we can do. And why do we do them? Why do we do community assessments?
To recognize the health needs in the area.
Exactly. And if there is any health disparities or issues that you've identified in that assessment, it's actually addressing it and continuing the research, collecting the data, and then working to develop policy to change what's going on, okay? So that's why we do community assessments, to overall improve the health of that community. Okay, so let's talk about the role of family, okay? So what about the family assessment? What were some of the key points about the family assessment?
With like the definition of the family, like who makes up the family? Is it a nuclear family, a single parent, an extended family?
Why is that important to know?
To know, I guess, like how the care will go inside of the home depending on who's inside of the home.
Mm-hmm. How much support there may be for the person, right? Okay, all right. So those are the kinds of information we need to know about the family. Yes, and there are many, many types of definitions of family. It's certainly not the way it was back when, you know, you guys are too young, but there used to be shows, Harriet and, oh gosh, what was?
Ozzy.
Thank you. I was going to say Oz, but that just sounded, because we just did the nursing process in The Wizard of Oz with the fundamental students. So I'm like, wait a minute, it is the, you remember that, right, guys? Oz, yes. Harriet. So that
Ozzy,
was
Ozzy and Harriet.
Fever, huh?
Ozzy and Harriet.
Ozzy and Harriet. That's it. Yeah. There's also Ozzy and Sharon, right? But you know, that was the 2-parent nuclear family. That's the way it was. What, Riley? Just the way it is, right? Huh? So if, as you guys have already experienced in your clinical settings, so the patients you care for in the hospital, how involved are the families? What do you have there? Arizona tea.
Arizona sweet tea. Yes, I'm not drinking an alcoholic beverage in class.
That's, neither am I. It's a little early.
Well, nowadays they're not really that involved because they can't come to the
right.
hospital.
That's right. And you guys have pretty much, that's how it's been for you all, isn't it? Since you started last spring, it's been COVID. So
Yeah.
yeah, your experience is definitely different. But so how are you involving families? Do we involve our families even from the beginning while they're in the hospital?
Call.
Go ahead, Phoebe.
You call and inform them the care and what's going on.
Okay. Yep. And so it's now a matter of phone calls, which certainly has changed that dynamic quite a bit, I'm sure. But honestly, most of our care, when we involve a lot with the families, it may begin with the discharge planning when you're, trying to figure out where this patient will go after the hospital. Are they going home? So what's that situation? But in reality, a lot more involvement with family takes place when you're caring for the patient in the community or and oftentimes that means in their own homes. So the family's right there taking care of them. Or the school nurse who's taking, has identified something with a kid that they have, one of their students, they have to involve the family, to deal with it. So family involvement is very, very important, and it seems to happen much more than in the community than even in the hospital before COVID. Yes, it's always a good idea when you're planning discharge for a patient that you include the family, because you have to know what kind of supports that patient's going to have in the home. So so they talked about the 15-minute interview, right, with the family. Why only 15 minutes? What happens after you start talking to somebody or you interview them? After about 15 minutes, they're done. They don't even you don't have time. They don't have time. So you want to keep your interview or your conversation concise, but yet meet the needs. So there are and in community, this is especially true. It's because in the community, as the community nurse, you are in on the patient's turf, versus when they're in the hospital, they're kind of on your turf, and the hospital rules, regulations, dictates what's going on. Whereas when that patient now is discharged and they go home, and if you're caring for them in the home or they're coming to one of your outpatient clinics sort of thing, they're now on your turf, or you're on their turf. Okay. So we have to keep that in mind. And there were 5 elements, key elements in that interview. And do you remember what the first element is? And this is true across the board.
Manners.
Manners,
Manners.
establishing trust. Okay. So you need to establish trust right from the get-go, because if you are in someone's environment, they're letting you into their space, into their home. They really do get to call the shots, okay? And so if you need to work with them to maybe change some of their behaviors, the only way that's really going to work is if you have established a trusting relationship with them. And that begins with manners, using their surname, and then asking them, what name would you prefer to be called, is always a good way to start an interview. Don't just assume that you can call someone by their first name, or don't ever call them hun or any of that kind of stuff. You stay away from that. Use proper names and ask what name they prefer to be called. So manners are extremely important. What else? What other key elements? What did they talk about during during that family interview? What else is very important? I think you mentioned it, Mackenzie. You want to ask about the genogram, who lives there, what are their ages, kind of get an idea of that family, what they're all about, their structure of that family, okay? So you want family genograms, ages, occupations, current health status. Why is that important? Why is that important?
Because they could be sick and not be able to take care of the patient themselves. So if they have things going on themselves, they may not be able to juggle both.
Exactly, right. Yeah. So if they're not well, or they're caring for, what if there's a lot of little ones in the house? And so there's the the daughter, and typically it does fall on the female in the family, not always, but often. So they're taking care now of their elderly parent, but they also have, three little ones under the age of 6, something like that. So how are they managing? How are they juggling all of that? So that's important because it identifies the support, and then also maybe even just like the stress level, of that household. What's going on there? What kind of work they do is important because you want to know if they're in a job where they might be working. Say they work in a factory and they come home and they have the chemicals still on them, so that contributes to environmental pollution. Where they work and when they come home. Nurses or healthcare workers that are now working in the hospitals, the first thing you want to do when you get home is just strip your clothes and get right in the shower, because you don't want to be bringing that disease or organisms or any contagion or any into the home that could infect or affect the household member. So you need to know, that's why you ask about occupations as well. Do they work night shift? Do they work day shift? If they work night shift and then they have to do caregiving during the day, when are they getting their sleep? So those kinds of things, you want to know about that. How about therapeutic conversation? What does that mean?
It's when you allow the patient and the family to be acknowledged in the conversation, but also to remember that you should be listening as well to the input of the family and the patient.
Absolutely. That's exactly right. The art of listening to what they are saying, letting them know that this is going to be time limited, so that they don't feel stressed that, oh my God, we're going to be talking and talking. So it's the art of actually listening and letting them know the purpose of the conversation and that there is a time limit. And then what other therapeutic questioning? What kinds of examples of therapeutic questions? What is that all about?
Knowing who to include into the care, like knowing which family did they want to include or not to include.
Okay, what do they want? What do they expect to get out of something? Okay, what is it that is their greatest need, their greatest challenge? So you want to ask those questions, because then you know where to zero in when you're having, you're working with the family. So what is their needs? What are their greatest challenges? And then finally, what's the fifth element of a therapeutic or a 15-minute interview? The family assessment.
Commending or complimenting the family, give them something.
It's hard to hear you, Olivia.
I'm sorry.
There you go.
Compliment or commend the family for positive attributes.
Okay, so commendation is different than complimenting. Okay, so commendation is being very specific about what it is that they are doing that is helpful, versus saying, no, you're doing a great job. No, you want to be much more specific. I see that you're able to help your mother, you getting up from the bed and you're walking with her and taking, to the bathroom, kinds of things. So very specific, not just a compliment, but more commendation, really acknowledging the family's strengths and what it is that they are doing correctly to help the person. So again, we talk about the family interview and this 15-minute interview and family assessment, because the family is really very vital to the ultimate outcome of this person that you're caring for in the community, and how well they're going to go from this illness that they may first have to better health. So the health illness wellness continuum. So that's extremely important that we keep that in mind and involve our families. So a couple of other things. Cultural competence, any comments about that? Do you guys have a pretty good feeling about cultural competence?
Well, I know that my classmates who are also in the Towson ATB program just took the Cultural Diversity in Healthcare class over this winter.
Ah,
Yeah, so I know at least Chuck and I'm sure other people in this class also have recently taken this class and written papers about it.
okay. So what's your biggest takeaway? What's can you share a little bit about first of all, why is it important, and how, and what is, like I said, your biggest takeaway from what you wrote or learned?
Well, I mean, I think that it's important because cultural factors affect people's healthcare status, how they interact with receiving healthcare services, what services are important to them. And I think that doing a proper assessment of that, a big element to bring into it is a cultural humility of sorts, understanding that you don't know everything, even if someone is, Middle Eastern or, like of a specific nationality, that doesn't mean that they ascribe to all of these, stereotypical ideas of like what health is. You have to have an idea of what background this person might come from and approach them as an individual who has their own unique cultural background and interaction with, how they perceive their health, what is important to them about it, and what they want to do to maintain it.
Yeah.
Also, I'm sorry if there's a lot of background noise right now. They're doing work in the house on the other side of me.
No, I don't hear the background noise, but I think that you hit it very well. That's exactly right. So not making assumptions that just because someone is of this particular culture that, we make assumptions about that culture. No, we need to ask. So really asking someone in your culture, is it appropriate to whatever the case may be? So just being sensitive to that is to a person's culture and their beliefs will go a long way in, again, having a established trusting relationship. Very good. All right, so certainly in the community, just like really even in the hospital, you have patients coming in the hospital of all different backgrounds, all different cultures. And the same goes for the community. We have people of many, 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 many diverse backgrounds. And that's, to me, is the beauty of community, really is the diversity. So, and having that mutual respect for people of all different cultures. And that could go a long way even in reducing some of these disparities if we recognize that, who these vulnerable populations are and what can we do to improve the quality of their life. And so, yep, so that's very, very good. Let's see. You know what? Usually I start the class, and I didn't do this, and for what it's worth, I just want to give you all a background of my experience as far as communities. So I graduated from nursing school a very long time ago, back in the 70s. And while I worked for a very short period of time, couple of years as an emergency room nurse, the majority of my background was in home care and hospice. So over 25 years that I went into people's homes and cared for people both with regular home care, which is our third lecture. We'll spend quite a bit of time discussing home health care, and then hospice care, which is end of life care. I did go back and I have a master's in public health nursing, which I had received in 1990, I think it was 99 is when I graduated with. So I went back very long time between nursing school graduation and master's. But anyway, I just want to let you know that the reason that I teach this is because I love community. To me, this is really the heart of nursing. And when a person gets to the hospital, we know that they're very, very sick. The hospital's only taking care of those that are extremely ill. And then even when they're so sick, they do their best to discharge those patients as quickly as possible back to the community. So even though 80% of care takes place in the community, only about 20% of the nurses work in the community. So we've got to switch that about and really get other nurses involved in community care. The patients want to go home. They do better at home. People, and again, they're surrounded by the love of their families, the support of their families. But not everybody has, a beautiful, idyllic family situation. So a critical element for you all as nurses, if you are in the hospital and before you venture out, and I hope that some of you do venture out into the community as nurse in your nursing practice, but is to ensure when that patient is being discharged from the hospital that you know what the situation is, where they're going home to, what are their needs, what is the safest discharge for them, and we will speak of at much greater detail about discharge planning and case management type nursing in the community, but it begins in the hospital. You guys know this, beginning day of admission, you begin discharge planning. But, and I'll give you some examples when we talk about that at the third lecture of a good discharge plan and one that's maybe not as good as it could have been. Okay, so we'll talk about that in greater detail. But it is just important when somebody does go home that they go home to a safe situation and they have everything in place that they need. So, okay, so that pretty much is what we talk about in our first lecture in terms of, the role of family, the 3 levels of prevention, talking about health disparities and how that affects the overall health of an individual, and then the different types of community assessment. So what you all will be doing is I have, and I'll post these groups. It's your clinical groups. So your clinical groups, so I see group 1 is Mackenzie. So it's Riley, because I have Lucy here, I'll have to change that. Sierra and Princess are all group 1. Group 2 is Phyllis, Diana, Orlando, Ebriona, and Charles or Chuck. That's group 2, right? Group 3 is Christian, Phoebe, Carol, Christina, and Natalie. And then group 4 is Samantha and Olivia. Well, what I did to even out everybody's group, because that was your clinical groups, I have Chuck and Natalie will now be in group 4 for group activities, okay? So one of the activities, and I posted on Blackboard, the windshield survey, a copy of that. In those groups, so again, group 1 are the 4 people that I said, group 2 will be everybody with the exception of Chuck, you'll be in group 4. Group 3 will be everyone, with the exception of Natalie, who will be in group 4. And then group 4 is Samantha, Olivia, and then Chuck and Natalie. Does that make sense? So I'll post that too, okay? what I want you all to do is to work with your group. And I noticed that 3 of the groups are going to St. Joe's. So it looks like the majority of you are going to St. Joseph's Medical Center for your clinical. And this is a little different than we've done it in the past. But each of your group, you'll work together, divide and conquer how you want to do it, to do a windshield survey. So I said, pick a neighborhood around your clinical site. We were kind of, originally when we thought about it this way, thought there'd be 4 different hospital settings, but they're not. There are 3 of you are at St. Joe's and 1 group is Good Sam. So you can decide what neighborhood you want to use. It can be around St. Joseph's. There's probably more than 1 neighborhood around there, right? You can decide that, but the instructions for the windshield survey are there. My Blackboard's open, but it's open on my laptop, so I can't look directly at it. But anyway, do the windshield survey, and I'd like for you, we'll do short presentations in our class on Monday of what you saw and answering there's 5 elements under 5 questions under each of the 3 elements. So under people, places, and social systems, there are questions. And so you guys decide how you want to do it, but then you're going to do a presentation. It's not a graded activity, okay?
I have a question.
Yeah.
Because we already had our clinical on Tuesday. So
Okay, well, you can still pick a neighborhood, you know, so you guys have your clinicals on Tuesday, huh? Okay, well, we could wait and do it the following week. You could do your presentation week 3. I guess we could do that if you wanted, and because you're all at the same time. You decide how you want to make that work. Can you guys do that? You know, even if you individually do it, but then come together and how you're going to present.
I mean, I don't drive, so the only time I'm going to St. Joseph is on Tuesday. So
Who is it that's talking?
Sierra.
Oh, Sierra. Oh, there you are. Okay. So you said you don't have a car? So
No.
Okay.
The only time I'm going to St. Joseph is on Tuesday.
Okay. Well,
if they want to wait till next week, that's fine. But if not, then someone else would have to drive out there because I'm not driving or taking a bus out there.
I understand. That's perfectly fine. Here's my thought. So what we're going to do today, after we're finished this conversation, I'm going to see if I can get you guys into breakout rooms. I don't know. I never did it before. Something new. We'll give it a shot. And you're going to be in your group. And then in your group, you can decide what how you want to accomplish the windshield survey so that you can report on it. And we can do the reporting in 2 weeks. I'll give you 2 weeks. That way you can work it around your clinical days. You're only going to clinical 1 day? Are you guys only going to clinicals on the 1 day now?
Yeah.
Oh, because of COVID, I guess. Right?
Yes.
Yeah. Okay. I'm going into Blackboard real quick here. Let's see. Are there any, while I'm pulling this up, are there any questions that you may have for anything that we've talked about today? Anything needs clarification? So you understand the difference between the social determinants of health and health disparities? You guys understand that? So where you live, where you work, where you play Those are social determinants, right? Health disparities is your access. All right, let's see if I can dig this up. Ah. Here. Okay. So for the windshield, it's opening. Hold on a second. Okay. So you're going to gain objective data about the neighborhood. You all decide what neighborhood as it relates to the people, places, and social systems. So you're driving through the neighborhood and answer the questions. So work with your clinical group, complete the survey in an area around where your clinical site is, answer with short answers, but be descriptive and detailed. Basically, you're looking at this community. You're going to identify any areas of concern. And then you're going to give a reason why this is of concern and what might a community nurse do to address that particular concern, okay? You do need to have a reference page. I have a cover page and a reference page because ultimately I'll set up a Dropbox so that your group can then submit your answers in your survey, but you'll do the presentation, okay? So that's, we'll make that due, and we'll do the presentations in 2 weeks, or next Wednesday. So, because you'll have had your, see, that really limits your time though, doesn't it? Because if your clinical's on Tuesday, that would only give you a day to answer it. So how about the following Monday, which would be the, let's see, let me look real quick on the calendar. Community class, the 22nd. Okay, so I'll give you some time to work on it. So the 4th class is on the 22nd, and you'll do your presentation of your windshield survey on that day. So be descriptive about the neighborhood, what's going on in that neighborhood, what are your concerns, what do you think a nurse can do to address those concerns, okay? I do have on here that it would be in an area around your clinical, and that was really only from, for the purpose of making it a little easier since you're going to be working in groups. All right. Questions? All right, let's see. All right, guys, let's see. So I also had posted a couple articles, just really short articles about how nurses in the community, you know, even yourselves, have you had neighbors that have asked you any questions because they know you're in nursing school about their health, this or that? So these 2 articles just talk about some of those areas where people in your community may ask you some questions and what you can do. Volunteering is another thing that you can do. In Maryland, actually in every state, there's an emergency medical corps. And it's called Maryland Responds. And if you're interested in volunteering as a medical in the Medical Reserve Corps, that is something that you can do now as a community nurse. There are volunteers with Red Cross, which is another community organization. So there are lots of ways you can get involved in your community. Will you guys be doing, because of COVID, I'm not sure. And, you know, as you know, I'm retired, so I'm not really only there very little. at school. You know, because all the teaching's online. We will do the simulation on the 24th. Do you all have to do your community service still? Or how is that going to take place? No community service? Okay,
It's my understanding that requirement for this course is bypassed because of the pandemic.
right. Okay, that's what I thought. I know that Dr. DeMarco was working on possibility of vaccine clinics, and that would be considered community service where I would go with you and we would do vaccinations, but I don't think that's come to fruition yet. So if anything changes, I'll certainly, let you guys know. Yeah, so there are definitely some ways that you can get involved even now as a student in your communities through different volunteer organizations. But Maryland Response is the Medical Reserve Corps, and they take nurses and nursing student, anybody who wants to volunteer. So I've been volunteering with them since the pandemic started, and at the testing site in Westminster, Carroll County, they do testing there, drive-through testing. So I've been a traffic director, which has been kind of fun, and volunteering to do vaccinations there too. So there are ways that you all can definitely get involved in your communities. So you saw the Healthy People 2020 framework that I posted on the Blackboard, right? What I'm going to have you guys do now, so Healthy People, do you all understand what Healthy People 2020 is? Have you heard about it in other classes? I'm sure you have, and the different indicators depending
Yes.
on what the topic is. So so now let's see if I can figure out breakout rooms. So I have the icon here. If I assign, so room 1 would be group 1. Do you know how to get into the rooms? Does anybody know how to do that?
You have to put them in a,
That's what I tried to do, and I don't know why it's not letting me assign. Okay. Oh, now I see, because you're there. Aha. That's why I couldn't do it before, because you all weren't in the class yet. Okay, so room 1, I'm going to put you in now. Mackenzie. Let's see. Sierra and Princess. Sierra and Riley. Okay. So you've been assigned to room 1. Okay, room 2 is Phyllis, Diane, Orlando. Phyllis, Diane, Orlando, and Adriana. Okay. So you guys are in your room. Now Christian, Phoebe, Carol, and Christina. Carol, Christian. Is it Christina or Christine?
It's Christine.
Christine, thank you. Okay. And then 4th, Natalie's not here today. Okay. So I'm going to open the room. So you guys should all be, can you see now that you're in your rooms? Has it worked? Aha. Let's see. I think they're putting you in your rooms. Can you hear me still? Oh dear. Can you all hear me? Can you, okay. I should have done the assignment. is as follows. Um, this is not right. Guys, are you there? Mm-mm. Okay.
Classroom
Yeah.
activity.
I did
Yep.
realize that you guys can all hear me, so I am trying to figure this out. Sorry. What I want you all to do is, I have Blackboard open here. You're going to go into Healthy People 2020. There's a class activity. That's why I gotta go to this one.
Yeah, Sierra actually just mentioned that. I got it pulled up on my computer, and I don't know if everyone else has it also.
Okay, can you guys all see each other in your classroom?
Yeah, so we can all see each other, and we can see your video and hear your audio too, because you're in breakout room 1.
Because I'm right there with you, so everybody
Yeah.
else is probably still waiting. Okay.
Yeah, and I think then you can hop into other rooms, but you
Yeah.
can only be in one at a time.
Oh, only one at a time.
Also,
Okay, go ahead.
you have disabled screen sharing. We can't share screens in this room. If you can figure out how to enable that, it would be good, because then we can share a screen and one person can keep notes while we all discuss it together. That's what we were doing in our breakout rooms during the portion of this class.
Okay.
The earlier.
Thank you. You are incredibly helpful. So let me figure out how to do that. Breakout room. Breakout room. So for you to be able to share, right?
Yeah, it's disabled.
And it's not, I'm not seeing how to do it. I don't think it's gonna work because share screen. That's it. Share screen.
Well, that's the option to share screen, yeah. You probably had to enable it before you created the room, to be honest.
Yeah.
Probably, but I don't know. But you can always ask, like, I guess for now, we don't have to share the screen for today. And I guess you can ask Miss Sinclair Bennett how she did it.
I tried to get this thing all together, but evidently I'm not. Oh, well.
Yeah, it also just might be like in the settings for the entire Zoom app somewhere.
Yeah.
I don't know. I've never enabled breakout rooms, so I have no idea
Yeah,
how to.
I'm gonna talk to Dr. Sinclair Bennett about it, because I'm gonna close all the rooms and bring you guys back, I think, okay?
Mhm. Yeah.
Because I don't think this is working right.
Yeah, well, you'll be able to address us all at that point anyway.
Okay. All right, I'm
All
gonna,
right, in the main
all
room.
right, I'm gonna just let the other rooms know. I'm here, but I'm having technical difficulties, so I think, so I'm just gonna end it and we'll do something different, okay? So I just wanted to let you guys know what was going on, okay?
We're trying to discuss what neighborhood, because we do have one person who does ride the bus to Clinical. So we're looking at her route and we're going to pick a way on her route the rest of us can drive to. So.
Oh, good. So you can talk to each other?
Yeah. Oh, yeah. We've been fine.
Oh,
Yeah, we've
good.
been talking.
Okay. Okay. Well, then maybe so I want you to go to Healthy People. And I just, oh, yeah, here it is. And then go to the activity for this, which is on Blackboard. And each group has an indicator, and I want you to answer the questions that are on that. So does anybody, can you open your Blackboard and see under classroom activities, the Healthy People 2020 activity?
Yeah, it says what is the indicator and what is the health impact
Yep.
report on life stages. Okay,
Yep.
I actually printed it last night.
Okay, great. So you guys are group 2, so you're environmental quality. Okay, so you'll see the 3 questions related to environmental quality. So take about, can you do it in what, 10 minutes? Can you do, is that enough time, or 15?
What questions for the environmental quality on the healthy people or on the windshield?
No, we're talking about the Healthy People 2020 classroom activity.
Okay.
You're
So
going to
we're just
report on the leading indicator topic by answering the following. So you're group 2, so your indicator is environmental quality.
Okay.
And then your questions are, what is the indicator and what's the health impact? Report on life stages and determinants affecting this indicator. Do you see
Okay.
that? Yeah. So you guys work on that. I'm going to get to the other groups, and I'll see you back in about 10 minutes.
Okay, perfect.
Thank you.
Thanks.
Okay. Now, let's see. I'm going to go to, let me go back to this group. Guys, sorry, I'm trying to figure all this stuff out. What I want you to do, I can't, you can talk to each other, right?
Right.
Yes.
Okay,
Yes.
excellent. So in Blackboard, under classroom activities, I had an activity for healthy people. So if you would pull that up, and you are group 3, so your indicator is nutrition, physical activity, and obesity.
Mhm.
Okay, so you can go on to the Healthy People website and then answer those 3 questions. What is the indicator? What is the health impact? Reporting on the life stages and determinants affecting this indicator. Do you see all those questions? Okay, so take about 10 minutes, and then we're going to report back on that. Okay? Sound like a plan?
Yeah, we have a question.
Yes?
So since we have about 3 groups going to St. Joe and all of us live around almost in the same area, is it okay if we just like do the windsurf around like somewhere close by?
Absolutely. Yep.
Okay.
Yes. Whatever works, that's fine. Yes.
Okay. Thank you.
Okay.
Thank you.
You're welcome.
Thank you.
Okay.
Okay, so I see the website at the bottom of this document. It's www.healthypeople.gov.
Okay. You talking to me?
Oh, no, I was talking to
Oh,
the
okay.
team.
Well, then I'm
Sorry.
going to go to the next group. Bye.
Okay, thank you.
Uh-huh. Hi, guys.
I mean, I could be.
Yeah. So I was trying to figure out all the technical stuff, which is always a challenge for me, but I think I got it. So you can talk to each other, right? So you're working out where you can do your windshield, whatever works best for you all. But in Blackboard, I had under classroom activity, the Healthy People activity. So your group 4, your indicator will be clinical preventive services. So if you want to go on the Healthy People website and then answer those 3 questions. Okay, what is that are listed under the class activity? Do you see that? Okay,
Yeah.
and then in about 10 minutes, we'll come back and report all together, okay? Sound good?
Yeah.
Okay, see you soon. Now, where is this? Hi,
Hello,
guys.
Mrs.
It's me
Murphy.
again. So you can, since you can talk to each other, I do want you to complete this Healthy People activity, which is in Blackboard. So does somebody, you have that pulled up? It's, I'm going to ask you, your group indicator will be access to health services. And then each group will report on the leading health indicator topic by answering the following. What is the indicator and what is the health impact? Report on life stages and determinants affecting this indicator. How does this lead to disparities? And then report on the most current data available. So you can go to healthypeople.gov and in about 10 minutes, I'll bring everybody back. So we have enough time to do it in about 10 minutes. Doesn't have to be fabulous, but I wanted you to at least go on to the Healthy People website and look at the indicator and answer those questions. Okay, so again, your access to health services.
So all 3 of these questions are from the website.
They're the questions that I developed for you to answer.
Yes,
You
from
should
the
get
from the
that
activity.
information. Yep.
Okay. You said healthypeople.gov?
Yes.
Healthy people.
It should be. You should be able to get that.
Okay.
All right.
All right.
Okay. So I want you, and then I'm just going to pop in and out and see how everybody's doing. Okay.
All right. Thank you.
Thank you. Thank you.
All right. Let me see if I could find.
Yeah, I don't think she has any more.
Okay, so I think the impact for the air quality index, like that would could increase like patients with asthma.
Respiratory disorders.
What was that, Diane?
Respiratory disorders.
Yeah.
All right.
Are these?
You guys doing okay?
Yes.
Okay. All right. I'm just popping in and out because I'm not sure how to get out otherwise without closing them all. All right.
Impact.
You guys are doing good? Any questions? Oh,
where-
you've got a shared screen. I love it.
Thank you.
Did you have a question?
Yeah, where are we supposed to get the information for this? Is it through the Healthy People website or?
Yeah, I would think that you can find it on healthypeople.gov.
Okay.
Right? Yes, that was my idea, that you would be going to the website to get that information. Okay. All right.
All right, thank you.
All right.
Just needed her to so she could split. So she could split.
You see
each-
I
that?
have my screen up.
There you
Okay.
go. I was going to say there is a way to share screens. I was just in another group and they're able to do
Well,
that.
I just can't share mine for some
Okay.
reason. It says it's
Okay.
disabled.
All
Wait,
right.
so are y'all seeing my screen?
Yeah. Whoever.
Is this where I'm supposed to be?
This is Mackenzie's.
No,
Okay.
that's my
Fantastic.
screen.
All
It
right.
says I'm doing Mackenzie's.
It does?
Yeah,
All
I'm gonna check out and go down to group 4 here.
right, let me show you.
Okay. Thank you, Ms. Bunting. Goodbye for now.
So it should be.
Okay.
Wonderful. You guys got the shared screen going, so you're doing all right?
I think so.
Okay. All right. Do the best you can. I will see you. I'm just kind of zipping in and out here. I don't know how to get out of the rooms without shutting everybody out. To unjoin. I'm sure you guys don't want me in there while you're working.
So Olivia, can I try and share my screen because I'm looking at something a little different?
Yeah, share that instead.
Okay. I don't know if this is gonna work. Let me try it though. What do you guys see right now?
Got it.
Well, that's the impact. So what's the indicator? I guess the limited,
I thought,
because we're supposed, our activities to go over access to health services. So what is the indicator and what is the health impact related to access to health services?
So
That's
the indicator we were given is lack of access to health services, right? And so that's what we have to answer all of these questions about it.
Yeah.
So what it is, like not being able to like go to a hospital, like living somewhere which is distant from a hospital, or, like where there aren't access to primary care providers or specialists, and the health impact is that like people can't access these services, and then like they're going to either like incur more expense and like commitment of time to accessing care.
It
by,
says
like,
it right here, unmet health needs.
That's
Delayed
not
in
the answer.
receiving
not
appropriate
the
care.
answer right here.
They're right there.
Oh, okay. Well, let's just
That-
copy and paste. Call it a damn day. That's
I was
the
gonna
indi-
ask. I was gonna wait till Riley was done talking. It's like, is this not it or am I tripping?
So what's the
He didn't want to
so
plagiarize.
so those are the indicators, right? Then what the health impact would be the high cost of care? Or I'm not gonna
No,
lie.
it's right here. It's right underneath it. Can you see?
Yeah, I can see. Which can you just search? Okay.
Yeah, these are the
At first it
impacts.
says
What
the
she
bar-
has to,
At first it says the barriers, and then right here, this one said the barriers lead to, and then it says unmet health.
Oh, okay. Thank you, girl. I haven't had a chance to look at anything. Like I passed out yesterday. Like after I came home, I took a shower, ate, and went the fuck to sleep.
yeah.
Yeah, I was tired. Thank God.
So is that what I'm putting?
That's what I'm putting.
Wait, are we actually turning this in?
No, we're just talking about it.
I think we're going to discuss it in class probably.
But I mean,
after
it'd be
this.
good to write it down so you don't get like stuttering and
Can I
or
not just?
stuttering and shit.
Just let me
Sorry,
talk about it.
guys,
I
I'm
don't
just
stutter.
trying
Yeah,
to
you can
figure out
talk.
whether or not- Do you have any questions? I'll just pop in and out. Any questions?
We have plenty.
So
No, I'm just kidding.
we are going to like present this to the
Yeah,
class
we'll
when we're
just
done,
talk
right?
about them in general terms. Yep, if you can answer these questions to the best of your ability, what you're finding.
Yeah, sure.
Yeah, okay, good. I'm gonna check in on the next group then, okay?
All right.
Yes.
No, adults,
Going.
lung cancer. Smoking causes lung cancer deaths. Okay. It also can cause coronary heart disease. Exposed to secondhand smoke increase their heart disease risk by 25 to 30%. Pregnancy complications, premature birth, low birth weight, stillbirth. Determinants of tobacco. Who's playing that?
Miss Bunting,
Yes.
where you
daughter.
for the answers to this activity we doing? Are we supposed to pull it all of it from the Healthy People 2020?
If you can find it there, yeah, I was just double checking to make sure that, but you should be able to find it there.
Okay, for all three of the questions.
Mm-hmm.
Okay. Because the last one, when it talks about the data, how do we know we are report on most current data available? I'm not seeing any data that correlates to the
So under healthypeople.gov 2020 leading health indicators. So let's see. Data, search the data. And your topic was, which group are you to? Environmental quality, right?
Yes.
Okay. So look under environmental health, select the area,
Oh, I found it, guys.
and then under data search that way. Data search. We could make it a little less, well, health disparities data available. So there is data available. How are we doing basically is the question, you know?
Well, better now that you showed us the website because we were just using the handouts off of Blackboard.
Oh, no. Yeah, I'm sorry. I thought I said that to each group. Apologize. Healthy People, the website, you should be able to find it there. All right.
Okay.
Okay.
I sent it on the last link, guys.
Yeah, I think I found it too.
Okay, good.
Yeah.
All right.
Oh, wait.
Hi, guys. How's it going? Questions?
We're going okay. We're just looking for current data for the last point.
Okay. Yeah.
I think we're doing okay.
Okay, good. All right. I'm just hopping in and out. We've got about 5 more minutes. You think that'll give you enough time to, again, it's as far as data, how are we doing? Are we doing well? Are we doing not so good? Do you think this is going to end up staying on there as an indicator for 2030? You know, that sort of thing. So data, yeah. All right. Back to here. Hello, checking in.
Hello.
How's everybody
Hi.
doing? Is it coming along for you?
I think so.
Okay. Any questions? You're finding the data. You know you're on the healthypeople.gov website, right?
Yes.
Get some of your information. Okay, good. All right. Like I said, I'm not sure how to get out of the room other than to go to somebody else's room. And I don't want to close everything because then it might shut everything down. So I'll see you guys in a few, all right?
That's how you leave a room. You just leave the room.
When you guys are done, just send a note that you're ready, okay? Please.
Okay.
Okay.
I don't know. Like, you know, both my parents work. I'm a 10-year-old at home alone. I'm not allowed to go outside. You know what I mean? Like, ask the second level of questions to get into this more, trying to get to the source of it. Does that make sense?
Yeah, I see what you're saying, but
But we don't have to go that
I don't know
far.
if we have to go that, especially with like only a couple minutes.
Okay.
Baseline 24.8% included counseling. So
Just send a, excuse me, real quick, just send a note when you guys are finished, okay? Couple
Okay.
more minutes. I'm just going in and out of rooms and passing that information on. Thank you.
We have to send her a note.
Well, can you write something or not that you're ready?
I don't think we can.
We
I think
Oh,
can.
you can't? Okay, well then
You
I'll,
have to call back the groups.
okay. All right, so couple more minutes then, okay?
Okay.
Okay.
Right there it says like, do not get canceling. Okay, slide up a bit, like there's some.
Guys.
How are we doing in this group? You about done?
I think so.
Yeah, we just,
I think so.
Uh-oh.
Sorry.
Baby. Is that your baby, Orlando?
It's my grandson. His,
Oh, it's your grandson.
yeah, he's getting tired. My son and his wife are pregnant again, and they had to go get an anatomy scan today. So
Oh my gosh. Oh.
he's mad at me right now because he was playing too long. Oh my goodness, he's
But you guys are doing otherwise?
Yeah, I think we're
Yes.
good.
You're
I
about
think-
ready? Okay, all right, I'm gonna just check in with everybody else and then bring you all back, okay?
Oh, great.
Say hi.
My daughter and I are both on school right now. We're taking turns.
Oh my
passing them back and forth.
Oh, and there's
She
your,
said bye.
oh my God.
Oh,
Well, there you go. This is, I remember when you were pregnant with this, yeah,
Aw.
chatting away. I love it. Oh, that's so fun.
Okay, go.
School in the 21st century, right? With the pandemic.
Right?
Okay, let me go to the next group. I'll see you in a minute. I'm gonna bring everybody back, okay? So my friends, are you almost finished in this group? I'm getting ready to bring everybody back.
Yeah, we got something.
You
Yeah, I
got
think we're ready to
something?
talk about this.
That's perfect. Okay, so I just want to let you know that I'll be bringing everybody back now in a couple minutes, okay?
Okay.
Okay.
All righty. So that was 1, 2, 3.
Two 2.1% to 65.2%.
Mhm.
That's a positive, something like that.
I think the big thing that I'm seeing is that even if we're not meeting the goal, we are like getting close to the goal. Like we are moving in the right direction
Right.
with increased screenings.
Mhm.
I'm gonna close the rooms in a couple minutes. Are you all about ready? To present, do you think?
More or less.
More or less?
Yeah.
That's fine. It doesn't, that's perfect then. Okay. All right, I'll be closing out in a few minutes, all right? So you'll, hopefully it's gonna work and bring you all back. Fingers crossed here. Technology, I'm getting good at it. All right. And where's my last group? Okay.
Out room and then go back.
Okay,
Okay, you guys about ready?
yeah.
Yeah, I think we're about to come back.
Okay, so now I gotta figure out how to bring everybody back.
It's that, so there's an option saying that we can leave breakout room at the bottom.
Oh, okay. So you all leave the room. 'Cause
Right.
I also had the option of closing all rooms.
Mhm.
Would do the same thing, right?
Right. It'll bring us all back.
Okay. All right. Well then, here we go. Dun, dun, dun. All breakout rooms will close in 58 seconds. Okay. think it worked. I'm so excited. Yay.
I know it was on Carol. It was because I was talking to Mackenzie. Thank you though.
Everybody back? I think so. 3, 6, 9, 12, 15. Yep. Okie dokie. So which group wants to present first? Or shall I sign you? Group-
I mean, we can just go in order.
Just go in order. Let's go group 1. Perfect. You got it. Okay, so talk about your indicator and then the questions.
Yeah, sure. We have some notes which Mackenzie would like to screen share for.
Okay, wonderful.
Yeah, so here we are. So we started by talking about what is the indicator and what is the health impact thereof. So what our indicator was access to healthcare, right? And we went to the healthypeople.gov webpage for access to healthcare, and all of these notes are pretty much just copy and pasted out of there, and we're going to talk about them a little bit. So for access to healthcare, right, there's not equal access to healthcare everywhere in America. There is, the lack of insurance, the high cost of care, and also just like regional disparities, people who are of far distance from healthcare. We talk about food deserts, but like healthcare deserts are also a thing. Particularly for like primary and preventative care services. Something we wound up talking about was how people access the emergency room as like a first point of contact with the healthcare system, which is, what do we say, not necessarily preventative. But so all of those things are, issues around the access to healthcare, and the impact thereof is that people are not receiving primary care necessarily, right? The second bullet point under impact says delays in receiving appropriate care, right? Or also not having access to preventative services, so you're not even accessing really primary preventative health care, or necessarily getting screened for things if there's a lack of access to primary care. So yeah, there's all of this stuff here that people's health needs are not met, and then there's also the financial burden of people going to the hospital for conditions which could have been treated earlier. Mackenzie, can you scroll down? Thank you. So we talked about life stages and determinants affecting this indicator, access to healthcare, right? And how does this lead to disparities? So, some determinants are like region, how close you are to hospital or primary care services, particularly for, children who are, depending on their parents or care providers to transport them to the pediatrician, or geriatric patients who might not be able to drive themselves, might be relying on family to, help them access healthcare services. Both of these stages of life, the very young and very old, could, lead to a lack of access, especially if it compounds with things like poverty, with not having a car, with relying on faulty public transportation for accessing your healthcare. Another thing that we talked about in 218, which was our perinatal and neonatal nursing class, we talked about, and we watched this video regarding Black mothers in Southeast DC who were attempting to access, prenatal care, and a lot of times having to rely on like 2-hour round trips on, DC's public transportation. And sometimes being late or missing appointments because they can't make it there on time, right? So that's a couple of different determinants of health which affect access to healthcare.
Great.
And we also talked about how this leads to disparities, right? Basically, people aren't able to get primary or preventative care, and then, receiving care first in an emergency situation, which I alluded to above, and we talked about more with this question, right? The emergency room should not be the first place you access healthcare, and yet in too many cases it is, probably because people aren't able to access or choosing to access healthcare for whichever reason. So then we talked about the most current data available, how we are doing with access to healthcare. I found this webpage on the CDC's website, which indicates as of October 30th, 2020, 8.3% of adults in America failed to obtain healthcare due to cost. That was 8.3.
What was the number again? Excuse me, how much? How many?
8.3% of adults aged 18 and over failed to obtain needed medical care due to cost. That was 3.5 months ago.
Wow.
And then also the percentage of persons with a usual place to go for medical care was 87.6%, meaning that more than 12% of Americans do not have a normal place they would go if they were feeling sick. You know, so that's showing that there's certainly a distance to go in improving access to healthcare, be it primary care, hospitals, or just making the care that people need affordable to them, no matter what the setting is. And also, I'm sorry, I sent the URL to our breakout room, but I'm going to drop it in the chat again if anyone wants to follow that link. That's the website that I just quoted from. Yeah, but then improving access to healthcare has all of the benefits listed that you can see on Mackenzie's screen right now. You know, decreased mortality, increased trust and rapport between, you know, healthcare providers and the people who are, you know, accessing healthcare. That rapport is really born of like an ongoing relationship. In my mind, I don't have a reference for that. But that's my feeling on the subject. And I think that improving access to healthcare is going to, you know, lead to these benefits that, you know, are listed on the website. So that's our thing on access to healthcare.
Very, very nice. So the current data, were you able, so is this indicator, are we showing some improvement then, do you think, overall with that indicator?
I really don't know what the trend
I don't
of
really,
that
I
is.
don't really know. I would like to say yes, but to be honest, like when I used to work in a hospital for like one of the providers, private provider, we would get a lot of people ER calls saying that our own patients are going to the ER instead of going upstairs to the primary care provider because they feel even within their own provider that they're not getting the care that they need because of the insurance that they have. Like even the providers are being iffy with what care they're delivering.
Okay.
So I don't know.
Sort of anecdotal, really, just from your own experience. So,
yeah.
Okay. All right. Well, fingers crossed that it is improving, huh? But we would probably, you know, if we had time to delve deeper into that, the healthpeople.gov, there may, under the data, there may be some indication there that how we're doing overall with that particular indicator.
Actually, I did just find another source which cites data from 2009 and 2010, right around the time the Affordable Care Act was being debated in Congress. Anyway, what this says is that among adults with public health insurance, 1 in 6 or 16% of unemployed adults reported a cost-related delay or lack of needed medical care, compared with 1 in 9 or 11.2% of employed adults. You'll note that in 2009, 2010, even the number of people who had public health insurance and were employed, it was 11% as opposed to 8.3% now, who had a cost-related delay or lack of needed medical care. It's worth noting that they also say delay or lack as opposed to simply not being able to access healthcare. That makes it not exactly the same piece of data, but that number might indicate that there has been some improvement. And I will also drop the URL to that second source, which I just cited.
Thank you.
Boom.
Just as a side, I had a conversation with my nephew the other day, and he was say, and I hadn't really thought about this, but so in most developing countries, with the exception of the United States, health insurance is not employer driven. It is universal. And if we could get to a place where it's not dependent on your employer, then there would be better access to care, wouldn't there? Because then everybody would have health insurance and it would be an even keel. So anyway,
Yes.
he's quite interesting to talk with, but he, I said, you make a good point. He was a big Bernie fan. I'm not sure about Bernie, but regardless, I hadn't really thought about health insurance as being employee. It is, if you are employed, you have health insurance, maybe, but you're still paying for it, yeah, so I thought that was very interesting. That would certainly change access to healthcare. Okay, group 2, environmental quality. Let's hear the report on that.
All right. Do you want me to go ahead and share my screen?
Sure.
Let me find it. Okay. All right. Okay, so we had to do in the environmental quality. So with healthy people, the indicator and what's the health impact was on air quality index exceeding 100 and children ages 3 to 11 exposed to secondhand smoke.
Okay.
So life stages and determinants affecting this indicator. In infants and children, you think about it, they can't remove themselves from the environment that they're in. They're stuck. So whatever choices we make as adults, it flows over to our kids that are in the house. So especially with secondhand smoke. So in young children or pregnancy, when you're exposed to those environmental exposures, it can cause problems with such as birth defects, developmental disabilities, and childhood cancer, asthma, SIDS is another one. It can obviously a lot of respiratory problems it can cause. Lead poisoning in the houses. So some of the disparities that we can find to fix in homes, work, schools, and communities, improving the air and water quality. So as community nurse advocates, we could, try to increase the water quality, the fountains that are maybe in schools. We all know, we've all been there. Some of those water fountains, I wouldn't even put my own mouth on them. So, looking at ways to fix those because little kids don't think, they just drink. They just go and they drink. The air quality, I do feel that has improved over the last several years, and the data will show that as far as the area they may live in. But again, they can't remove themselves. That's where their parents live. So that's kind of more of a hard situation, minus the secondhand smoke. So educating the parents on smoking cessation and the importance of secondhand smoke around their kids would be a big community thing. Strengthening the social fabric of the community, that goes right back to that as well. Giving more education resources to the community, employment opportunities, physical activity and healthful diets will also help with that. We all know the things that are modifiable are physical activity and diet, and then helping to decrease any injuries or accidents in that environment as well. So it all stems back a lot to where they live, what they're exposed to, how their parents are, and what their parents' beliefs are. So that a lot of the education is going to stem back to the parents.
Right.
So with secondhand smoke, it actually is getting better. I definitely think back in the 70s, 80s, and 90s, everybody smoked. It was more of the cool thing to do. I can remember as a student smelling like smoke. I never realized it then until I moved out of my parents' house and I no longer smelled like smoke, but I do feel a lot more people are more conscientious about that. So you can see secondhand smoke among children ages 3 to 11 decreased 27% from 2005 to even 2016. So that's actually exceeded the target for Healthy People 2020. So that's awesome. That's terrific. And then the unhealthy air quality also decreased 43%. And I think a lot of that stems to our government and our nation and the things that have been put in place for air quality, especially like with factories and things like that. I think that's why we're seeing a decrease in that as well.
Right.
So that kind of sums it up.
Okay. Excellent. Nice job. Very good. Yeah, and I do think that we are definitely seeing some improvements in the environmental air quality and overall environmental indicators. So excellent, very good. Group 3, nutrition, physical activity, and obesity.
Okay, I'll try and share my screen.
Okay.
Okay, so for ours, the indicators were adults that are obese, children and adolescents considered obese, total vegetable intake for persons 2 years and older. The health impact of our topic was individuals who are obese have a higher chance for chronic disease and morbidity and mortality, specifically related to high blood pressure and cholesterol, diabetes, asthma, anxiety, and depression, mostly amongst young adults and adolescents. The life stages that we talked about go from infancy to older adulthood. For infancy, we discussed the importance of proper mental and physical development, and that this time frame is really important for setting the stage for growing into more nutritious and healthy decisions that'll last lifelong. We discussed the importance of many school-age children not being able to afford school lunches or even prepare the healthy meals at home to bring to school. And that older adults, as they get older, their metabolism lowers, and they don't necessarily have the time or access to healthier alternatives, especially when they're in assisted care facilities and so on. The data, we struggled finding a lot of data. So we found an article on healthcare.gov talking about public programs in schools that provide free meals to students. Although a lot of the time, these free lunches might not consist of the most healthy choices available. And there's been, especially in the last 10 years or so, there have been initiatives put in place that have kind of tried to switch that over to, more fruit and vegetable based school lunches. Additionally, they talked about the proportion of doctor visits that include discussion and education on improving weight reduction, nutrition, and physical activity. They found that they're still about 8% below the target where they want to be. And additionally, along with the education comes behavioral treatment. So talking about self-image related to obesity and the impact that it has. And this is still well below the target. And lastly, just children and adolescents aged 1 to 19 that are considered obese. They're about 2.3%. You can see the figures there above where we want to get that obesity level. So we're making progress since, last Healthy People, but we still have a long way to go until the next iteration.
Okay. All right. Yep. So, yeah, Michelle Obama, when she was First Lady, she had an initiative for the nutrition, improving nutrition and healthy food access. And it was during that administration that schools, as you said, Christian, 10 years it's been, where the schools did have to start offering healthier choices. Just as a side, my neighbor is, she's in charge of the school programs and a couple of the middle schools here in Carroll County. And she said when they had to go to the healthier foods, the kids didn't want to eat it.
No.
They were skipping it because they, so she said it was kind of sad, really, because they had to do it. They were mandated to provide these healthier options, and a lot of the kids wanted nothing to do with it. So that's probably a result of they're not used to eating healthy from the beginning. So it's sort of a learned behavior too. So it has to start, as you pointed out, even with infants. We have to start at home. So that education. So yeah. So very good, very good. So we still have work
Just
to
to kind
do.
of piggyback off of what you said, like what you're saying about like how
Mackenzie?
I said, just to kind of piggyback off of what you were saying about like how Michelle Obama, like they did the switch or whatever, because I was in school when that happened. So I remember when they made the changes and nobody wanted, like people really did stop eating lunch. Like they stopped using the vending machines because it's not, I mean, I guess part of it was because it was healthy, but it was kind of, it wasn't like the good healthy choices. It was kind of like stuff that nobody wanted to eat. Like nobody wants this.
So you actually experienced it firsthand. Yeah, that's exactly what Mary, my neighbor, she said, kids just were like, no. So, but hopefully, you know, but when you think about kids that live in areas where they don't have the options from the time that they're infants, you know, there aren't places to go for healthy foods that the parents can get healthier food choices for them. They're used to eating more the junk kind of stuff, and you know, certainly sugar and they say white flour as well, but sugar is very addictive. So you know, if you're into eating junk food and stuff from the time you're very young, it's a hard habit to break. So, but again, healthy education toward health promotion and making those choices and having the access to be able to get the healthy food, you know, hopefully we can continue to improve this target. I have a feeling, do you think from your report that this one will stay as an indicator?
More than likely.
Yeah.
I would assume that this isn't, I mean, we've been trying to change this since, I mean, obesity really took off in the 90s, especially. And I remember from when I was in, you know, elementary school, the rectangular pizzas. And honestly, if somebody took that away, I'd be pretty upset too. It was like my favorite day of the week when we had the pizzas. So I can't imagine that it's really gonna improve. And I assume that if the kids aren't getting what they want from school, they might try and, you know, just bring them from home if that's an option. But once again, that's not the option for everyone, especially when finances are taken into consideration.
Right. Yep, that's true. I don't know if I had mentioned it in the lecture. I can't remember, but here in Carroll County through the health department, they have the healthy people in Carroll County. Oh gosh, I'm sorry. But anyway, they look at indicators that are part of the Healthy People 2020. So it's a partnership for a healthier Carroll County. That's what it's called. I knew it would come to me. So this partnership partners with many, many different people with interests, including restaurant owners, people with that have gyms in Carroll County. I was part of this group at one point before I started teaching at CCBC. I was part of the consortium, and they put in programs in the schools for they had to do the healthy choices for food, but then they also developed a program for activity and made it a contest for the kids, you know, if you do this much running a week or whatever it is. So there are partnerships in different counties through their health department will address some of these issues. So even though Healthy People is at a federal level, it breaks down into your various health departments and different consortiums that develop as a result to try and improve that indicator so that it can come up like we did with environmental, you know, with the smoke and the air quality. Those kinds of things are some of those goals are being met. So anyway, yeah, it's definitely still a concern and an issue. So, okay, and finally, group 4, clinical preventive services.
So our group, we had clinical preventive services. That was our indicator. Its impact, it's supposed to prevent injury and illness through programs and education for all age groups. And then, so it's based on the life stages. We looked at children, they have obesity screenings, hearing and vision screenings, and immunizations. And children have their own disparities along with adults, and they are similar. But one of the disparities we talked about for vaccination specifically would be lack of parental support, because unfortunately there have been trends of parents not wanting to vaccinate their children recently. And even if the child wanted to get vaccinated, if they're not emancipated or over 18, they don't have enough power to really take control of their own health care. So that's a disparity specific to children only. And then of course, like lack of transportation, but that really, that goes along with what their parents have access to. For adults, some clinical preventive services, their weight, cholesterol, and blood pressure screenings. Also screenings for colon cancer, lots of different cancer screenings, pap smears and mammograms. And then also booster immunizations, like the shingles shot and the pneumonia vaccine. Disparities for adults could be lack of financial means or insurance, lack of transportation access, fewer community healthcare locations. Even if you're in a rural area or if you're in a very urban area, you could have a lack of places to go for these kind of services, and also not knowing that these services exist or the importance of them. Like if someone isn't educated on like what a pap smear is and why it's important, they're probably not going to seek out that kind of information. So it needs to be very like public knowledge, and unfortunately it isn't. So we found some data on a couple of different things. We looked specifically at children vaccinations, glycemic control, and hypertension. Overall, there have been improvements. For example, the children vaccinations between 2012 and 2018, the percentage of children who received their recommended doses has increased 6.4%. From 68.4% in 2012 to 72.8% in 2018. Their target is 80%. So even though the target hasn't been met, and it hasn't been met with many of these, we're still working towards it. So I would still consider that successful, and maybe in like the next round of Healthy People, like Healthy People 2030, they could modify some of the programs and some of like the education, just modify the plan to make it more to make the goal more attainable.
Okay, good.
For glycemic control, it's been similar. There was an improvement. It wasn't statistically significant, but it still is an improvement from the original baseline. And for hypertension, it did mention in when it was reviewing the hypertension information, that the populations that have the highest rate of high blood pressure were non-Hispanic white persons and those with activity limitations, without public health insurance or diabetes. And I think it really recognized like the disparities, because those are people that have better access to these things, unfortunately. The change in hypertension wasn't significantly statistically significant as well, but it is still an improvement from the baseline overall. The target is 61.2%.
Okay, that's great. That's a pretty good improvement, 40%, right? Are you saying it's good or it's not so good? I'm trying to read this. Let's see. Target 61.2. So we still have a ways to go, but it's an improvement over the baseline. Is that what?
Yes.
Yeah. Okay.
I think by the baseline, because it kept mentioning the baseline and it didn't have like the baseline information. I think by the baseline it meant like before the Healthy People initiative. So this is a very like long-term goal.
So this one will probably stay as an indicator. I'm thinking that, there's still room to grow. to this one. Okay, all right, thank you. Thank you, Olivia. All right, guys, any questions? So let's, if you, yep, there we go. So did that help to in your understanding about disparities and the health of people goals and the indicators and what we need to do there? All right, so for our next class, we'll be back on Monday, same time. And I will have that, I have to finish the recording, so I should have that to you probably before the end of the day or tomorrow, okay? Will that give you enough time? Because you have the weekend and all still, so. And just, you know, continue on as far as making sure you watch your videos and the readings. And I think this was a really good class. You guys really do participate quite a bit, and I appreciate that. And if you have any questions, you can always email me privately if you want, or I can be reached either a regular email through CCBC or on message from Blackboard. Okay. Any questions? Anything for the final? Okay. All right. Well, stay well, stay healthy, and I will see you guys on Monday. Take care.
Thank you so much, Ms. Bunting.
You're
Have a good one.
welcome. Have a good day, everybody. Take care.